Hello, my name is Stephanie Henderson, and I'm a medical librarian at the University of Kentucky. I'm going to continue the conversation today about researching health disparities topic and the generalizability of the results that are found. Kayla introduced you to the topic of transportation, access to healthcare, and Appalachia. She showed you how to search for articles on the topic, and now I'm going to focus on the results of that search. Before we get started, we need to define generalizability. So what is it? Very simply, generalizability is a measure of how useful the results of a study are for a broader group of people or situations. Our original topic focused on transportation, health accessibility for all Kentuckians. But that got us very few results. So when we refined our topic, we actually wanted to look in the Appalachian regions. So this would broaden our results without compromising our topic. For example, we can assume that some of the barriers and facilitators to transportation and healthcare access for people living in the Appalachian regions would also be the same for Kentuckians living in that portion of the state, or even similar for rural Kentucky regions. Now let's take a look at some of the articles in our results set and gather some tips on how we can scan abstracts for potential articles. Okay, firstly, I want to go ahead and change our display options in PubMed. By default, these will be summary, and I want to change it to abstract. And then also by default will be 10 views per page, 10 articles per page, but I want to change it to 200. As I look through the results that I see in my set that Kayla provided for us, I can see topics like when we're thinking about healthcare access, I can see things like rehabilitation, broadband capacity, cancer care delivery, drug abuse or substance abuse. This is talking about Georgia counties, but that's not what we're looking for either. So I can see a trauma center, primary care. So I can see that I need to refine what I mean by healthcare access. So I want to just, based on these results, I think I want to change my kind of focus and just, really hone in on primary care. So if I want to look and see if this result set, what articles talk about primary care, I can just simply type in, hit my Control F and type in primary care. Okay, so then I can see the results. So this one again, not really what I'm looking for. Let's take a look at this one. The previous one was about broadband capacity. That's not what I'm interested in. But this article it's interesting. So it says it's the distressed state of primary care in Virginia, pre-Medicaid expansion and pre-pandemic. So what did they do? So let me look at the abstract and see what did they do in the method. So they surveyed primary care practices. Okay, where in Virginia? Because there are rural areas of Virginia, there's Appalachian Virginia, and then there's also urban. So I need to see what areas of Virginia were the primary care practices located. So I can look at this figure and I can see that, okay, so they surveyed places all over the state. So then you can see here, yes, some of these are in the Appalachian region. Okay, so I got my Appalachian, so that's good. So what else am I looking for? I'm looking for transportation. So again, I'm going to go back to my abstract. So they surveyed practices And it says over half address social needs like transportation and unstable housing. Okay, so what does this mean? What do they mean when they say they address transportation? So I'd have to actually read the full text article if I wanted to find that information out. But this one seems like it might be a good one that I could, the generalizability of the results. It's looking at primary care practices. If I'm focused on primary care practices in Kentucky, in Appalachian Kentucky, this article might be good because this is looking at primary care practices in rural Appalachian, Virginia, and other Virginia areas. Okay. All right. So let's go back. Okay. So I'm just going to send this to the clipboard. Then I go back to my results to keep searching. Do primary care again. Okay, great. So again, I'm just using the tools at my disposal to quickly flip through the results. Okay. Let's take a look at this one. Geographic characteristics of loneliness in primary care. Okay. We're looking at primary care practices in Colorado and Virginia. That's not really what I'm looking for, so I don't want to use that one. Patient perspectives on acute illnesses. And I'm looking at this one. It's looking at community dwelling older adults. So I could look at that, but I'd have to define the population. Is this my population for my research question? That's something to consider. This could be a potential article, but then you need to make sure that you look at the populations. If this one is just focused on community dwelling older adults, but then some of your other ones are focused on individuals that are not elderly or not older, that could be an issue. That's not generalizable. So let's go back. Let's look at some other ones. This one is talking about muscular dystrophy, teenagers and young adults, talking about primary care. This primary care isn't the focus of the article, so this isn't what I'm looking for, and see how it was just used in the abstract. Yeah, this one is looking at immigrants in New York City, so that's not what I'm looking for. Okay, Montgomery County, Virginia. I'm not sure where Montgomery County, Virginia is, but it does say it's a underserved population. Okay, so it says that it's an underserved community. It's a particular county in Virginia. They conducted focus groups with the community members, and the results are probably what you might consider, what you might expect in an Appalachian region of Kentucky. So I'd have to Google this Montgomery County, Virginia, to make sure it's in the Appalachian region. I believe it is. But some of the results in these focus groups and interviews sound like some of the results that I have seen. So some of the perceived barriers to healthcare reported by participants is lack of access to affordable healthcare, complexities of health insurance and payer status, lack of transportation, okay, and geographic distance. So depending on our original research question and need, we can see that the articles that don't necessarily seem to fit, the Kentucky aspect, after some investigating, they might have enough generalizability that traits that we can consider them for our research purposes. So it's not necessarily Kentucky. However, it's similar characteristics of the region of Kentucky that we were interested in. So if you have any questions about the topics that we've covered today in any of our videos, please feel free to reach out to any of our medical center librarians. We can definitely help you with this research process. Thank you.